We call upon Dr. Vivek Dave, D12385, FP413, Comparative Outcomes in Endophthalmitis caused by biofilm positive and biofilm negative bacteria. Dr. Vivek Dave.
Am I audible, Dr. Bishwas?
Yes, fine.
Yes, sir.
Go ahead, please. Go ahead.
All right. So good afternoon, everyone. I'll be presenting my article and a paper on comparative outcomes of endophthalmitis caused by biofilm positive and biofilm negative bacteria. I have no financial interests and I represent the Retina Institute from the LV Prasad Eye Institute, Hyderabad, India. Intravitreal antibiotics form the mainstay of endophthalmitis management. Various studies have shown increasing resistance developing to commonly used antibiotics. Whether biofilm formation plays a role in increasing antimicrobial resistance or reducing the overall clinical prognosis is currently unknown. So what exactly is a biofilm? Biofilm is an ancient ubiquitous life form that is characterized by cells attached to a living surface embedded in an extracellular polymer produced by the microorganisms themselves. Biofilms have been shown to increase bacterial survival, provide protection and resistance to antibiotics. With this background, we had a study question to compare the presentation of eyes infected with biofilm positive and biofilm negative bacteria, to compare their microbiology, and to compare their anatomic and functional outcomes. This was a prospective, non-randomized, comparative, consecutive case series conducted at the LV Prasad Eye Institute, Hyderabad, with appropriate Institute Review Board approval and in accordance to the tenets of the Declaration of Helsinki. The inclusion criteria for the study were all microbiologically proven cases of endophthalmitis positive for bacterial etiology. The exclusion criteria were fungal etiology, patients not consenting to the study, and culture negative endophthalmitis. So all the vitreous biopsy samples of bacterial culture positive cases underwent biofilm formation testing by the crystal violet plate method and the tetrazolium salt reduction assay. The results were reported as biofilm formation positive or negative, and further clinical management was as per institute protocol laid down in this landmark article in Retina. Definitions of outcome were as follows. Favorable anatomic outcome was the absence of hypotony, retinal detachment, or inflammation at the last visit. A favorable functional outcome was best corrected distant visual acuity of 20 by 400 or more, and a logMAR or a logMAR less than 1.3. Along the 1 year of enrollment, we included 83 cases of endophthalmitis, of which 50 showed no biofilm formation and 33 were biofilm positive. All the treating physicians in the clinic were masked to these results of biofilm formation. The results were statistically analyzed by the Metcal statistical software, wherein paired t-test was used for comparison of the normative data and the Mann-Whitney U-test was used to compare the non-normative data. A multivariate logistic regression analysis was done to assess the effect of various demographic and clinical factors on the anatomic and the functional outcomes, and appropriate odds ratio were reported. A p-value of less than 0.05 was assigned as statistically significant. Coming to the results, the causes of endophthalmitis like post-cataract, post-open globe injury, endogenous, and others were all statistically comparable between the two groups. Coming to the microbiology, the spread of various gram-positive organisms and also the various gram-negative organisms found in culture were comparable across the two groups. In antibiotic sensitivity testing, the antibiotic sensitivity for the commonly used antibiotics in endophthalmitis was statistically comparable between both the biofilm negative and the biofilm positive groups. Coming to the clinical outcomes, we found that the mean number of surgical interventions in the biofilm negative group was statistically lesser than the biofilm positive group. So also the functional and the anatomic success was statistically better in the biofilm negative group as compared to the biofilm positive group. When a logistic regression analysis was run for all the demographic and clinical factors which may have affected the anatomic and the functional outcome, we found that none of these factors had any bearing on the anatomic or the functional outcome. Thus, the strengths of this study was the prospective and a comparative nature, a uniform treatment protocol across the treating physicians, and the fact that the treating physician was masked to the outcomes of the biofilm testing. In conclusion, biofilm formation can occur in the clinical setting of endophthalmitis. When affected by organisms that form a biofilm, the anatomic and functional outcome is worse, as overall antibiotic resistance and other clinical factors were comparable. The increased virulence and poorer outcomes can be hypothesized to be due to the physical barrier effect of the biofilm to the antibiotics. I thank everyone for the kind attention and will be happy to take questions. Thank you.
Yeah, questions, please. Questions from the judges, please. Judges, questions?
Dr. Dave, do other microbial organisms like mycobacteria, fungi or other organisms, do they secrete biofilms?
Yeah, thank you, Dr. Reddy, for that question. So as mentioned in one of the slides, we actually did a small pilot before we started off this study. And we found that Candida does form a good biofilm in the lab, but filamentous fungi, we failed to demonstrate a biofilm formation, and we were getting them as clumps in the laboratory. So that was the reason that we kept the entire fungal subset of endophthalmitis out of the study. So in our observation, Candida species do form a good biofilm, but the filamentous organisms do not.
Understood. Thank you.
Thank you.
Any other questions, please?
Dr. Dave, very nice presentation.
Thank you, Dr. Das.
So based on the results that you have got, how has it kind of helped you to extrapolate it in your clinical settings? Has it actually helped you change your practice patterns in terms of a very low threshold for surgical intervention if you find a biofilm positive organism?
Right. So thank you for that question. Now we have just about started applying it to the clinic. So the way we envisage going forward is, now this test takes about 48 hours to give us a result, which actually is an acceptable timeline. So once the initial empiric therapy is done, the way we envisage going forward is if it's a biofilm positive organism, then we would look at doing a complete vitrectomy in that particular patient. Say if the corneal visualization does not allow, then we would even resort to an endoscopic approach or taking help of a temporary keratoprosthesis, from the point of view that these organisms are likely to have a relatively worse outcome as shown in the study. So basically go all guns blazing as soon as possible.
Any other questions, please? Okay, if there are no other questions, I have thank you very much, Vivek. If there are no other questions.
Thank you, Dr. Bishwas. Thank you, everyone. Have a thank you.